Smile.
I'm smiling.
Hi, everyone. We're just waiting for all the attendees to join. We're here with Dr. Eli, Dr. Brownstein, myself, Saul K. And today's topic is stress and the ECS. The ECS is the endocannabinoid system. But we are going to begin in just a minute if everyone will wait patiently. Happy to have you on another CannaTech webinar. This one medical. Our last one, we covered the financial sector and the COVID crisis. This one, the medical panel, is on stress and the endocannabinoid system. And our next panel coming up with next week is on the legal status right now, how COVID is going to affect the current growing season coming up for hemp. But we'll wait half a second more and then we're ready to begin. I see attendees still coming in. So welcome everyone to CannaTech's medical panel, stress and the ECS. Carrie, if you'd like to play the intro. Hi, welcome to CannaTech's webinar number 2, Stress and the ECS. We're joined by Dr. Ely and Dr. Brownstein. Hi guys, how are you? Robin, where are you? How are you?
Thank God I am fine after a couple of very close brushes with corona exposure, but thankfully I am fine. I am in Maryland, in Potomac, Maryland, and I am here with all of you.
And people following social distancing, what's the current climate in Maryland?
Yeah, so actually Governor Hogan, our governor, is in charge of the entire governor task force. And he has been very aggressive with closures, with social distancing, with every day he is giving live talks, live reports of our hospital situation. Our numbers have escalated quite a bit, which is why he really is pushing all of the things. Even several days ago, people were walking outside with no masks or anything. Now you go outside, you have to wear a mask. And every single message is about washing hands and about just all of the things, but in a very strong tone. In my neighborhood, wow, it's so quiet. We don't hear any airplanes. We don't hear cars. Once in a while, you'll see somebody walking, because we have a grocery store within walking distance. So we'll see someone walking to get their groceries, and that's it. And it's actually kind of eerie. I did have one weird experience. I went shopping early in the morning the other day thinking it was going to be empty, but I had forgotten that he had instituted baby boomer hours. And so when I got there, the place was full, and I think I was one of the youngest ones in the whole building, and it was so eerie to see like these hordes of people getting their food and buying out stuff, big baskets full of clothes, food and everything. It was crazy, but it's part of the picture here. So.
At least you got Amazon delivery. We don't here in Israel yet. Dr. Mark, you're out there in Colorado. How is it?
I am. I'm in Durango, Colorado, and over here in rural America, it's a little bit unsettling for me as a medical professional. There's a lot of people still out and about. I'm surprised how many people are on the roads and walking around. So I'd like to see it being taken a little bit more seriously by me.
Yeah, absolutely. So, Robin, can you give us a little bit of background on you, your medical history, not personal
Yeah,
medical
sure.
history, treating patients, and a little bit
Yeah.
about what you've done with Gaucher's disease, and just give everyone some background.
So
Um,
yeah, I have actually been in medicine altogether about 38, 39 years. And I had a very standard training, but went to Georgetown and Prince George's Medical Center for family practice residency. But very early on, I started seeing the flaws or the problems that weren't being addressed in my standard training. So really very early on, I started researching, coexistent with my regular schooling, a lot of alternative methodologies, like a lot. And when I finished my training, I opened up the Center for Integrative Medicine. And in that center, it was essentially a family medicine practice, but using many, many different integrative methods for healing. And I did that for quite a long time. And then I got involved in genetics in the field of Gaucher's disease because I have 6 children, and 3 of them, only 2 were born at that time, were diagnosed with Gaucher's disease. And at that time, there was no treatment. The physicians at NIH were working on a treatment. I left my practice and said, I want to be with you all. You don't have to pay me. I just want to be here, because I realized that if I did that, my son more likely could be one of the first ones to get the treatment. So that's what happened. I helped develop the protocols, and thank God that developed the first treatment. And my son, my second son, was the first person in the world to receive that treatment. And thank God I'm hearing other sounds. I realized that if I did that, there's a lag. I don't know why is that happening. But anyway, thankfully, I got that taken care of, and it really spawned a whole lysosomal storage field, which is very active today on hundreds of diseases. And then after that, I got involved in information healing technologies, a very different subject matter, using homogeneous information fields for healing. And I did that for quite a number of years. And then I got involved in cannabis about 4 or 5 years ago. And of course, became intimately involved with iCAN and CannaTech. And then I became a certifying cannabis physician in Maryland, New York, and Florida. And so I am very now familiar with using cannabis for many, many, many different ailments. And so I bring that into a more holistic, which I've always had, a holistic approach to healing.
Hi, thank you, Rob. Are you currently seeing patients, or are you seeing patients over telemedicine?
Well, yes, everything's telemedicine now. In Maryland, I see patients personally. In New York, I see it through telemedicine. And in Florida, it would be telemedicine too. I'm certified, but they haven't set it up yet.
And
so now,
how did you get certified in Maryland, New York, and Florida?
yes, you have to take a test. You have to take a course. Each state because it's federally illegal, it's very complex, because each state has its own rules, its own regulations, its own structures for how doctors actually even become certified. So actually, New York, of these three, New York is the most stringent. The demands to become certified are more stringent than the other two. However, you do have to input your data. You have to take either a longer course or a shorter course. And then after that, you become certified. And then you are on a registrar list. And so the commissions in the different state will potentially match up a patient with a physician in their general area. So that's how it works.
Amazing. Over to you, Dr. Mark. Little bit about your background. You're a psychiatrist. You've been treating patients using cannabis for a while. Tell us a little bit about your background.
Sure. I'm a child, adolescent, and adult psychiatrist. I was fortunate enough to complete my training in '02 and moved to Colorado at that time, so I could start utilizing cannabis as well. I was trained in a traditional model of psychiatry of using a lot of medications to treat people's problems. However, I found that using so many medications at high doses and in different combinations could cause a lot of side effects and toxicity. I listened to my patients and learned so much about how cannabis could be helpful, man. I mean, that's how I figured out how any other medicine would help them, right? Is you would ask your patients, how's your Prozac working? How's your Depakote working? How's your Zyprexa working? And so I started doing the same with cannabis, and was finding cannabis helpful with PTSD, with bipolar disorder, depression, anxiety, insomnia, hypochondriasis. I mean, the list goes on and on. So many things that I was finding cannabis helpful for, more helpful than medications maybe, and without side effects. So over the past 20 years, I've kind of dialed my practice into helping people get off of psychiatric medications utilizing cannabinoids.
And that's fascinating. How many patients have you treated? What sort of lessons have you been able to learn?
I mean, I've treated thousands and thousands of patients, so the biggest lesson I've learned is to listen to your patients. If I would love if doctors would listen to their patients and how they say cannabis is helping them.
Got it.
Instead of discounting it and thinking about cannabis as a drug of abuse.
Yeah, absolutely. And this is why it's so important, because the data is so disjointed. It's so resting in different nodes where we can't access that. Your best practices, what you've been able to learn about treatment is siloed. And the same with so many other doctors that I've met in this space that don't have the ability like we have with common medications because they've been clinically trialed to access that. But before we jump into that, I'd like everyone we're going to play a quick video around what the endocannabinoid system is and why it can potentially help us. And then we'll get into some stress responses and things that we can do. So Carrie, if you'd like to play just that intro video, please.
In the early 1990s, scientists discovered something pretty amazing. There is a biological system in the human body that responds to cannabis. This is called the endocannabinoid system, or the ECS. Let's take a look at the ECS in action. Emma is going for a jog in the park when she trips over a rock and twists her ankle. It hurts for a moment, but the pain subsides quickly. That's partly the work of the ECS. By producing molecules called endocannabinoids, which interact with the cells in our bodies, this system gets rid of those unpleasant sensations. But pain is just one of the functions that the ECS regulates. It's also responsible for regulating memory, mood, sleep, appetite, stress, and the immune system, to name a few. In other words, the ECS is responsible for maintaining balance within the body. So where does cannabis come in? Some of the molecules in marijuana, primarily THC, mimic the body's natural endocannabinoids, so they're able to communicate with the ECS receptors as well. These receptors are located in cells all over the body, but especially in the brain and the immune system. This explains why cannabis can ease so many symptoms like nausea, pain, insomnia, and inflammation. There's still a lot we don't know about the ECS and how cannabis interacts with it, but scientists are already calling it one of the most important systems in the body, and we're just beginning to discover its potential.
So thank you for that from our friends at Canigma. Robin, can you delve into a little bit about stress, anxiety, and fear? These are tough times. We're all facing stress in a unique way at the moment, and no one is immune to it. So what is stress? How does it how does your body process stress? What happens to your body? And what can we do about that?
Okay, so as an intro to this subject, I have to always mention my mentor, Professor Hans Selye, who was actually a PhD scientist in the 30s, 40s, and 50s and beyond from Europe. And in 1936, he wrote the following: stress is a non-specific response of the body to any demand for change. And that is something that is very important to understand, that all things that are happening at all times, internally, externally, everything around you and everything going on inside of you can loosely be understood as a stress or a stressor. Now, the other definition that is important to work with is stress equals the end result of these repeated responses or repeated triggers, be it external or internal. So when you hear people talk about stress, oh, I'm stressed out, or God, that was stressful, or oh, I have this stress in my life and that stress in my life. And of course, seeing this in relation to the current situation that we are all in, the external reality, the external things that are going on trigger internal reactions. But the key is that the body always wants to go back to what we would call the center point or the homeostatic set point. It means the balance of your body where all the systems are being regulated. Now, life is not that. We are not even enjoying to live that way. We are enjoying to interact with the world, but we have mechanisms that continually draw us back to our own center, if you will. And what's fascinating is watching how every generation of physicians and scientists have really been working on that idea, working on that principle. He was actually nominated for many scientific Nobel Prizes and other prizes over the course of many years, because it truly changed the way people thought about almost everything. And in our generation, with the research that we now have, thanks to the grandfather of it all, Professor Raphael Mechoulam in Israel, and then secondarily, all the other research that has come after that, we now know that the endocannabinoid system is the primary regulating system of the body. It means it's the overarching system that regulates and interacts with every single system of the body. Now let's talk about the nervous system in a way that kind of allows you to see it a little bit more clearly. The nervous system has one part of it is called the autonomic nervous system, and it's divided into generally two branches: the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is fight, flight, freeze. Fight, flight, freeze. And so the first thing that happens when a stress comes, if you look at an animal, even the deer in the headlights, the first thing is to freeze. The sympathetic nervous system makes that happen. The next thing is either fight or flight. And so that system is geared toward protecting against all the would-be stressors that are out there. Now, our stressors, one of the biggest stressors that we're all enduring is a constant barrage, which we can't control, a constant barrage of news, really scary, bad news. That is not a saber-toothed tiger, but in terms of evolution, it acts as though we are all being attacked by saber-toothed tigers at every corner, at pretty much every hour of a day. So that's the sympathetic nervous system, and it's there to protect us. The second part is the parasympathetic nervous system, and that is rest, digest, relax, repair. And that is mediated through the parasympathetic nervous system, primarily through one very, very long, amazing nerve called the vagus nerve. And there's tons of research about vagus nerve modulation for many, many conditions. But the key for us right now is how do we take our bodies out of constant, unremitting sympathetic overdrive into parasympathetic rest, relax, digest, repair. So what we have tools to do now, the tools that we have now are many. One is, well, basically they're all manipulating the endocannabinoid system. And I forgot to mention another wonderful teacher and really a foremost individual in the world of cannabis, and that's Dr. Ethan Russo, very prominent neurologist who's done amazing work elucidating the characteristics of the endocannabinoid system. And he coined the term, which I always use, and that is the endocannabinoid deficiency syndrome. Meaning, when a person is stressed beyond its ability, its inborn ability to handle stress, it goes into what's called a deficiency state. And therefore, it is no longer able to mount the responses within the body that actually bring the person back into a more parasympathetic system or modulation. And so what we have to do is work on the ways that we can modulate that system. How do we do that? And there are many, many, many ways to do that.
Let me come back to that in 1 second, because that's going to be one of my questions coming up. Mark, what have you learned from your treatment protocols that are successful for stress? Robin very eloquently told us about the fight, flight response, and then how to relax that. What type of cannabis is best? Are we talking high THC, high CBD? is it really individual? And yeah, what are some of the best practices that you've learned?
Well, I think it's important for everyone to know that the stress response includes a decrease in the ECS, what Robin was talking about, that deficiency syndrome. So when you're exposed to trauma, exposed to stress, you can have a deficiency in your endocannabinoid system. You can replace that. And I think you were talking about getting to that later, but I'd like to say that now. So if you're low on your endogenous cannabinoids, because we all make cannabinoids inside of our body naturally. I think that's something important for everyone to know, that this endocannabinoid system, we all have that within ourselves naturally, and we all make cannabinoids. However, when we're stressed out or traumatized, we don't make as many cannabinoids. So that's where we can take external cannabinoids. You can take CBD, you can take THC, CBN, CBG, the list goes on and on, right? But basically you can replace the cannabinoids that you're missing inside with ones from the outside. You asked me what's best. That totally depends on the person. If someone is cannabis naive, does not normally use cannabis, it's best to start with just CBD, right? Because anyone can take CBD, and I can guarantee that they're not going to have a negative psychoactive response. The next step up from that would be adding a small amount of THC. Here in Colorado, it's wonderful. You can go to the dispensary and get micro doses. You can get something in a 20-to-1 or an 80-to-1 ratio, where you can actually buy a product that might only have a 1/4 milligram of THC. That's great, man. No one's going to have a bad response to that. I also think if you do want to get on an edible protocol, it's best to take it 3 times a day, is what I found, to keep that at a steady state in your system.
We had a really good question. Can you talk, Robin, about developing tolerance to cannabis?
I think both of us could speak equally well on that. Yes, definitely. People do develop tolerances, and the way I handle it in my practice is by cycling people on and off. And I have to work with each individual person and their own system and their own, really their own setting also, in terms of how to manage tolerance. But it does happen, yes.
It's wonderful that it happens. And let me tell you why, man. Because if I have to put someone on cannabis, and let's say they don't respond to CBD, I gotta add a little THC. You gotta slowly work people up sometimes to get to the right amount. Thank God they have tolerance and they can take it. Think about cancer patients that have to take 1 gram a day of RSO. If they didn't develop tolerance, they could never get up to that dose.
Right.
So we can think about tolerance on the negative end of it, when you've had too much and it's not working as well. Well, then it's also beautiful. You can take a break, man. Give yourself 48 hours off cannabis. And I don't care how tolerant you are, you're going to get reset. So the tolerance factor of cannabis is wonderful, and it's unique compared to other medications. How quickly you can develop the tolerance and how quickly you can reverse it too.
And so, I mean, I generally recommend taking a 1-day break once a week. I've seen people do that monthly. Is there any sort of rule of thumb as to how to take that cannabis break in order to reset your system?
Do you want me to?
So,
okay, go ahead.
I think that in terms of taking a break, dude, there's no gold standard. There's no reason why everybody should take a break. Think about it, man. With mental illness, you're not going to tell someone to stop their Prozac or their Depakote once a week. Why would we do that with cannabis? Tolerance is okay. It's not the end of the world, and you have to look at the risks and the benefits. And so If someone's tolerant but they're stable, that's great. And if telling them to stop once a week is going to cause them to get suicidal or have panic attacks, I wouldn't recommend it.
I think the operant word there is if they're stable. Because, for example, if you have, well, let's say you're treating an autistic child with a number of behaviors that you've been able to attenuate using various cannabinoids and terpene profiles. If they develop tolerance, they will sometimes revert to the upsetting behaviors, self damage and self-harm and rage and acting, out in a way that makes it very, very difficult for the parents and other caregivers. So it all depends, but it has to be managed. It's very individual, though.
It's also, they can take more. If someone with severe autism gets tolerant to their dose, they can take more, man. You don't have to worry about hepatotoxicity or nephrotoxicity like you do with a lot of the other medications we prescribe, man. You can give a little bit more. It might also be that you can use cannabis for breakthrough symptoms. So oftentimes when we stabilize or regulate our mood or anxiety with cannabis, it's not perfect, man. You might still get triggered. The news might come on and tell you something really harsh. Your partner might be having a tough time. Your kids could be having a tough time. And that's where inhaled cannabis can be very helpful. Either vaped or even like an inhaler. A colleague of ours with Maven Hemp makes a great CBD inhaler. And these things can be used in between oral doses for breakthrough symptoms to mitigate panic symptoms, for instance.
And we've heard a lot, obviously around dosage, the rule of thumb is start low and go slow. That was the culmination of a 10-week course that I took here from the Ministry of Health for pharmacists. And it really is individual and it really is dependent on the patient. But that is a rule of thumb, start low, go slow. I like what you're saying in terms of if tolerance is built up, it's not terrible. And to use that. Do you find that patients are in tune by themselves to dosage, or is it something that needs the input of whether it's a bud tender or a medical professional? Robin, do you want to answer first?
I'm sorry, I didn't hear that. Say it again. I don't know what happened.
How intuitive is a patient to how cannabis is relating to them? I mean, you're lucky that you live, Mark, in a state that has legal access with an amazing array of products. That's not the norm. Certainly not in Israel. We're still, even though very advanced in research and development, we only have flour and some basic oils available. How do you really dial into your body and listen to what's going on, and how much do you need to involve your medical professional in this?
Well, in my case, whenever I see a patient, I always spend a certain amount of time discussing that with the person, trying to inculcate a greater sense of intuitive feeling of being in tune with their bodies. Many people are very out of tune with their bodies. And really anxiety, because it's constantly pushing the sympathetic nervous system, people are not in tune with their bodies. Their bodies just have to do a certain thing. And that's the whole defensive posture. People get in tune with their bodies, which that could also segue into a whole other discussion. But they're getting more in tune with their bodies by turning on the parasympathetics. And by turning on the parasympathetic system, the body naturally, you naturally will be more in tune with your body. And so I actually spend a fair amount of time in discussing this with my patients. And then I maintain a two-way interaction with my patients. I like to get feedback. I personally don't like the idea of just starting them on it and then leaving them alone. That's my way. That's my personal sense of my own feeling about it, my own responsibility. And so I in the first month or so, at least, I get weekly feedback from my patients.
Are there
And
any tools that you use for patients to record that data so that you can see it? Mark, I don't know if you have anything to add there as well, but what do you use as a patient-physician interface?
Well, actually, I have all my patients journal, but I don't see it. They journal, and then every week they kind of give me a report based on their journal. And depending upon what I see on the report, then I can make an adjustment. Based on where I see them. I do or I don't make an adjustment, but sometimes I need to. And we need to work with either the route of delivery or the particular chemovar / strain that they're using. I need to change it. And so that's how I do that.
Mark?
So I typically focus on symptoms and side effects, like we would with any other medication. So are we following focus, anxiety, depression, panic, suicidality, psychosis, mood stability? It depends on what symptom. And then you would check in about how they're tolerating it. I would generally start people off at a dose equivalent to their weight. It's a very simple formula. If you take your weight in kilograms and divide by 3, that's about how much CBD you should be taking 3 times a day. And then I would slowly start adding in small amounts of THC, and then kind of adjusting from there, depending upon the reports. And you might adjust it differently at different times of the day. You might have a very high ratio CBD to THC during the day because someone wants to have feel less effects of THC. But then at night, you're going to want to have a higher dose of THC to help them sleep, combat nightmares. But again, you're going to kind of adjust it every time you meet with them and talk with them. How are you sleeping? How's your mood? What side effects are you having? And then you just tweak it a little bit from there. Oftentimes, people who are just starting cannabis need the most help, right? Like any other medication. But after their experience with it, after they've tried it on and have taken it for a minute, then they have a better idea about going up a little bit or staying the same.
And
So
Mark, what as a psychiatrist, so cannabis is one thing in your toolkit. What other medications? Let's talk a little bit about interactions on one hand. What medications are typically used for anxiety and stress, and then how do they interact with cannabis?
So what's wonderful about cannabis is how safe it is. The interactions you have to worry about mostly are the intoxicant side effects. So if someone's taking a benzodiazepine or a tranquilizer for anxiety or sleep and you add something to it that can have an intoxicant effect, you're going to worry about the increase of that. So someone who's not used to cannabis, you definitely don't want them to be driving on it, man. That's what you're going to worry about. If they combine it with another medication that already might affect their cognition, it's going to increase that. Fortunately, with most psychiatric medications, cannabis is safe. If there is a cytochrome P450 interaction, we really don't have to worry about it because it's not significant.
So what are common side effects that you see from cannabis?
And yeah, and then I just want to say, like, let me think, and having done this for over 10 years and thousands of patients, I was talking with Robin about this earlier. I can't think of anyone that has had a clinically impressive medication interaction that I've been able to tell. That's incredible, man. What I do hear from patients mostly, if they are going to have something negative, it's going to be an anxiety reaction to cannabis, and that's because they had too much THC, or a paranoid reaction, again, because they probably had too much THC. You're going to have certain, what's interesting is certain disorders are going to be more likely to have that anxiety reaction, which kind of sucks, man. Anxious people are more likely to have an anxious reaction to cannabis. And we all talk about how the new cannabis is so strong and it's more likely to have that. But here in Colorado, which is probably home of the strong cannabis, it's also home of the light cannabis. We have cannabis now that's like 20-25% CBD and 1% THC. Or like I was talking about edibles with an 80-to-1 ratio, where you can have 20 milligrams of CBD and 0.25 milligrams of THC. You can really mitigate that risk. And so again, to quote you and what you were talking about of start low and go slow, you don't have to worry about those side effects, man. Like I was saying earlier, if you give someone a low enough dose, they're not going to be anxious or paranoid from cannabis. It's the people who, without proper medical guidance and talking to the wrong bud tender, go in and take a dose of 5 milligrams of THC, and then they get bloody freaked out. And then they don't want to take cannabis again because they had a bad reaction. And that sucks, man.
And it's so common. It happens so often from patients that I hear, well, I had an experience that wasn't good. I don't think that's for me. It's quite common. One of the questions, Mark, they missed your calculation on dosage of CBD to body weight. If you could just go back over
take your weight in pounds divided by about 2, or your weight in kilograms, and then divide that by 3. So if you weigh 90 kilograms, take 30 milligrams of CBD 3 times a day.
And then obviously don't buy your CBD from the gas station. But that's another topic. What about pre-existing conditions? Schizophrenia, psychosis, other mental disease that could potentially be contraindicated for cannabis use?
You got to be cautious. Just because something has a risk of causing that does not make it an absolute contraindication. In psychiatry, we use antidepressants in bipolar disorder. It's been very well documented that there's a risk of suicidality with antidepressants. However, the possible benefit can outweigh the risk. So we try them sometimes because antidepressants can be lifesavers in bipolar disorder. So just because there's a risk of antidepressants causing mania or suicidality doesn't mean we can't try them. Same thing, I believe, with cannabis. I know with schizophrenia, there's definitely a risk of increased psychosis. However, that doesn't mean that everyone with schizophrenia is going to have that effect. If you talk to your patients with schizophrenia, some of them are going to be using cannabis. Regardless of whether or not I tell them to, man, some of them are going to use it. So I urge providers to listen and see what your schizophrenics tell you about cannabis. If it's telling them it makes them more paranoid and hear voices, tell them not to take it. If it's not making them psychotic and is helping them to relax, that sounds positive to me. Again, I'm sorry, Robin, practicing personalized medicine. not putting people into these boxes by their diagnosis, but looking at them as individuals and thinking about their medication responses as individuals too. Be cautious.
I also think that it's so important to realize, and I've seen this over and over again, cannabis is not a monolithic thing. It's many, 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 many different plants with many different chemical profiles. And so overall, we know that the part of the plant, this one cannabinoid, delta-9 THC, that one cannabinoid and its immediate secondary metabolite, 11-hydroxycannabinol, those are the ones that can trigger more psychosis in a person with a schizophrenic backdrop. Those are the ones that can provoke anxiety and paranoia in non-schizophrenic individuals. So when I hear people say, like what you just said, Saul, a little while ago, I tried it, it didn't make me feel good, it didn't work for me, so I'm not gonna entertain it. That requires that response requires education to understand this is a very, very protein plant, and we have access and are able to use different preparations from different strains or different chemovars, and really tailor the treatment to the neurological and sort of psychological backdrop, if you will, of each individual person. Mark's stress on personalizing is crucial. Absolutely.
It really is personal medicine at the end of the day, in a totally new way. Mark, one of the questions is coming up around substance abuse, people with substance abuse disorder, people who have a history of addiction disorder. You've used cannabis for that. Can you talk a little bit about?
Absolutely. What's interesting is that I was trained with the dogma of cannabis as a drug of abuse and looking at it in that lens. And I think that when we do that, that's when we don't listen to our patients and how it's helpful as medicine. I see patients every week that tell me how cannabis has saved their life from either opiates or alcohol or meth. Every week, man, people thank me for what I'm doing and tell me how it's saved their life from addictions. Where I live, people can go to 12-step meetings and talk about how cannabis is a treatment for their addiction. Where I live, the probation officers refer people to me for medical cards if they're alcoholics or opiate addicts, man, because people recognize that cannabis is a treatment for addictions. The other wonderful thing about cannabis, compared to other drugs of abuse and alcohol, is that, yeah, cannabis can be abused, but that doesn't mean you have to quit. If you're abusing cannabis, you can shift your cannabis to healthy use. Whereas if you're abusing cocaine or heroin, you can't shift that to healthy heroin use, man. If you're addicted to alcohol, I've never met a heavy alcoholic that could change to healthy alcohol use, man. However, cannabis, someone can shift to smoking way too much cannabis unconsciously to using cannabis healthfully, intentionally, and medicinally. The key is shifting from unconscious patterns of maladaptive use to conscious, intentional patterns of healthy use. It's beautiful, man.
Amazing. Wanted to go into sort of where where do you see a shift happening I mean, you're reaching different spaces. I'm in Israel, the shift is slower. You're in a very forward cannabis state. When and how do you shift the global patient population and turn them onto cannabis? How have you done that in your local populations? Mark, if you want to start.
It's word of mouth, man. It's incredible over the last decade, the shift I've seen in people of conservative ideology being open to cannabis. I'm also a child psychiatrist, and it's wonderful now, man. I have parents bringing their kids in asking for cannabis, and these are not maybe the most progressive thinking people, but I think as people see people in their community respond to cannabis, and then community leaders speak up about it, the word gets out, especially within religious groups, man. Someone goes to church talking about, or synagogue talking about how cannabis has helped, and people listen. They start to thinking about it as medicine, not drug, but as medicine. And I think if we can all practice that language of talking about this as medicine and not as a drug.
Robin, do you want to add anything?
Yeah, yes, I would. I think it goes in two directions. So the word of mouth is bottom up. It's from the grassroots, from the patients and each other and their communications with one another. But then there's what I would call the top down. And I'm not speaking in terms of hierarchy, but just for the sake of discussion. The top down is educating the physicians, which is something that I have been working on and trying to accomplish. And I find that when I'm invited to give a lecture to a group of physicians and dentists and so forth, the first thing I have to deal with them is the stigma thinking. There's so much stigma still around this plant. It's kind of amazing in an awful way. But I have to deal with that, and I have to sort of systematically break down the thoughts of the stigma and then educate them. Because actually only 13% of all medical schools in the United States even teach the endocannabinoid system. It's just sort of sad how long it takes once we know things for it to get actually taught to physicians. And that was one of the things that was amazing to me, even talking to young students. Wow, we're not being taught that. This is now, we know this is basic information now, or it should be. And so it's really, for me, it's about educating physicians and as well, the bottom up. So I think it's happening, obviously Colorado, it's happening much faster there than anywhere else. And also the data in terms of the opioid deaths, as far as I understand the data, it's gone down. And many other negative things in society have gone down. People were worried, oh, you have a dispensary in a neighborhood, it's going to bring the neighborhood down. No, actually not, to the contrary. And so I really think it's a process. We'd like to go faster. Maryland has been, I call it dawdling, but they've been really taking their very precious time to consider opening it up to adult use, which my idea is that there is no such thing as recreational. Everything is medicine, everything. It just depends on what people are medicating. Medicating with alcohol is considered to be socially acceptable, even though 80 to 90,000 people die every year from alcohol-related situations. But cannabis they call it recreation. They don't say, oh, I'm coming to have a nice relaxing smoke or whatever it is to relax me after a very fraught day, right? But it's changing over time. It's just a matter of being patient with it, I guess.
Let's talk about PTSD. We're all in a situation where I think, we're going to be facing consequences of what's happening today, both financial, work-wise, relationship-wise. PTSD is a problem for the veterans of America. They spend $66 billion on PTSD. That's a number that I got through my CyTech connections. Mark, a little bit about psychedelics, a little bit about PTSD, and where are we going in this, current environment?
Well, so let's talk about cannabis and PTSD a little bit. There have been some studies and some literature pointing to the use of cannabis decreasing the chance of having PTSD. So the idea that cannabis is almost like a vaccine for PTSD, I'd like people to tune into. If we can strengthen up our endocannabinoid systems a little bit right now, that will lessen the effects that this is going to have on us as far as PTSD. As far as psychedelics go, and cannabis is another psychedelic, we can use psychedelics to help us work through trauma, to help us understand our trauma and create new patterns of thinking, and so that we don't have the same trauma responses. So when psychedelics are used properly and therapeutically, what they do is they create ego dissolution, and with ego dissolution, a break in the default mode network. When you do that, you create new patterns of thinking and new patterns of brain activity. Hence, changing your response to trauma and your beliefs. I know I touched on that real briefly, Saul, but I hope that helped answer your question.
Yeah, 100%. And so besides cannabis, what else can people who are suffering right now from stress do? What should they be asking their doctors for? How can they get through this situation?
Do you want me to take it?
Robin, talk about other things they can do to tune up their parasympathetic.
Right. So actually, it's as close as your own breath. The truth is that breath control is the single greatest pathway to self-mastery, actually. And I would say almost bar none. There are lots of psycho-spiritual reasons for this, but the truth is that every single emotional state, every single one, is accompanied by a breath pattern. And if a person can learn, if they choose to learn to tune into their breathing patterns and learn the simplest breath pattern is 5, 6, 7. Inhale to the count of 5, hold to the count of 6, and exhale to the count of 7. Now, many people who are really in an extremely triggered state will not even be able to do that. They'll be able to maybe inhale 2 seconds and hold it for 2. You start wherever the person is, but that single change in breathing can make all the difference in the world. All the difference in the world. And there's, I will just say, if there's one book that you want to get on that, it's called Just Breathe by Daniel Brule, B-R-U-L-E. He is probably one of the world's foremost authors on the subject of breathing and how it can help achieve self-mastery in many, many directions.
Robin, we had an earlier question about your mentor around anxiety. Can you give us his name again? People wanted to look him up.
Yes, his name is Professor Hans, H-A-N-S, Selye, S-E-L-Y-E. And actually, you know, when he first started talking about it, he got a lot of pushback, which is normal. Anyone who is changing the way people think, that's normal. All of us in the field of cannabis have gotten a lot of pushback from our peers. And I absolutely, when I go in to give lectures, I get a lot of pushback at the beginning and a lot of skepticism and even cynicism. But by the end of the lecture, they have more insight, they can understand, they can begin to open up to learning it. Yes.
Excellent. We're hit our hour mark. I'm just going to ask anyone in the audience who's still with us if you'd like to ask any final questions. And thank you both for participating. I think you gave everyone some insightful information in what they can do now, how stress works, what you can possibly do to mitigate it. We will send through a recording of the webinar to everyone that participated, and we'll include their contact information for Robin and Mark if you have any specific questions and wants to follow up. And next week we'll be doing our legal panel on what can be offered in stimulus programs for hemp and marijuana programs in the United States. Together with Hoban Law and Shubnub. So we're looking forward to that. Another thing that we are launching is a continuing education program for physicians, pharmacists, nurses, and even certifying bud tenders. We'll be releasing that over the next few days. So this is a great time while we're all stuck at home to catch up on that learning. Mark, I asked you before, do you have to keep up any accredited learning in order to keep your license active? Robin, do you have to?
Absolutely. So I really urge healthcare providers to take these courses and to learn about cannabis and get certified in cannabis, and then have those count towards the hours that we all need.
Right. So this is a great time. You know, you look on the bright side, you're at home with your families. It's a great time to catch up on some of the educational pieces that you're missing. We'll take one last question from the crowd. It's actually really interesting. They asked as to, is there a difference between men and women when it comes to the impact of potency on cannabis consumption?
In my experience, definitely. This is my experience. Women are quite a bit, I would say a few orders of difference sensitive to THC. Obviously, it's a generalization, but in my experience, actually in my personal experience as well, but also in the experience of patients, friends, family, and so forth. Women in general are quite a bit more sensitive to THC, and I always have to take that into consideration when I'm dealing with my women patients.
I find that women are more in touch with their bodies in general than men, and I think that's part of the sensitivity part too. But in general, men compared to women with all substances, including cannabis, all psychoactive substances, men take higher doses.
Right. Well, thank you guys for giving over your time to help people learn during this interesting times we find ourselves in. And stay tuned for more coming from CannaTech. And we'll be releasing SciTech. Both Mark and Robin are on the board of SciTech, looking into the whole psychedelic world and learning from what we've seen and experienced in the cannabis world and how that is going to play out with psychedelics. And obviously having two experts like this as our medical advisory board is very, very important. So stay tuned for more CannaTech and more SciTech. Stay safe, stay home, and happy Passover or Easter. Enjoy this time with your families.
Take care of everybody. Bye-bye.
Thank you. Be well.